Nadir is like frozen. Dr. Nadir, you are mute. Yeah. I think Dr. Nadir is having some technical difficulties, but
yeah, it looks like
I think he's
like the network something like that.
Yeah.
Yes. Yeah, because he was sharing his screen and then everything stopped.
Yeah. No problem. We'll wait like another 5 minutes probably, and then we'll start.
Inshallah.
I can see Dr. Mia Osman is there.
Yes, I'm here.
Yeah. Sorry, still like I'm still new, so I'm just trying to remember all of you guys' name and all that.
Yes, it's okay. We're still getting to know each other.
Yeah, sure.
Yeah.
This is the second day only. Yeah.
Yes.
So who will be presenting first? I have no problem. Like.
I have no problem too. If I think Dr. Amna was supposed to, I think, present a study, and then I'm going to do a presentation about SPSS.
Okay.
Sounds good. Again, welcome everyone.
Yeah, we understand that you probably might have some difficulties, technical difficulties, Dr. Nadir.
Yeah, so now we can start. So if the green team is ready, please jump in and you can take the lead, Dr. Sumi.
Okay, who will be leading from green team today?
Actually, Lubaba had some urgent matter to take care of, so I will be following, and if you want to lead, we can both share that. So I will leave it for you and be on the back end.
Sure, no problem. So we can start now. And from yellow team, I'll be updating some vaccine hesitancy, the project, and Dr. Osman will be presenting some SPSS, and Dr. Amna will be presenting case control and cohort studies. So I think I can start, and then Dr. Osman, and then Dr. followed by Dr. Amna probably. Is that okay with everybody?
Sounds good.
Okay.
Thank you.
Can I share my screen? I mean, I'm co-host. Yeah. Dr. Nadir, can you make me co-host? Okay. Okay. Everybody can see my screen?
Assalamualaikum. Yes, I can see it. Assalamualaikum, everyone.
Yes, Dr. Sumi, we can see your screen clearly.
Okay. Just give me 1 second. I'm just. Where is the slide show? Okay. All right. Good evening, everyone. So I'm going to present my research project, vaccine, how to overcome vaccine hesitancy. As we discussed earlier, I have a small grant for this, and then I'm working in Detroit area to how to overcome vaccine hesitancy in underserved population. So my it's a fellowship. That's where I got the grant, and it's in the same time, like I'm also doing masters in Michigan State University in public health, and my project focus is promote vaccine awareness, education, and positive behavior change among the low income, low literacy population in the service area in Detroit. I mean Detroit underserved population, and it's in a pop-up family health center. So as I think my previous fellow colleague, they already know what's my project about, but still for the new fellows, I'm a little bit going to give you some introduction about my project. So it's basically like how I overcome the vaccine hesitancy among the underserved population. So as we all know that these are the data I collected when I was designing and like writing my proposal or grant for that my project. So you, all of the whoever in the United States, I think everyone can go to their government site. It's called michigan.gov, as I live in Michigan. So it's every state have that site, and you can get all this data from there. And like you can see from my this slide that they have like how many vaccines delivered, and then how many doses administered, initiation, completion, all of those things. And then when you collect those data, you can have some idea like how many population got vaccinated by this time and how many population initiated and all these things. So these are very important data to like look that how to overcome this hesitancy. So here, the Michigan government data, it shows that Michigan Department of Health, their goal was actually the 70% of the Michiganders age 16 and up vaccinated as quickly as possible. When the vaccines are available back in December, there are basically 3 vaccines are now available in US, that is like Pfizer and Moderna and J&J. However, for people like whoever in 12 and 12 to 18, only Pfizer is authorized to use, not the other twos. And 95% of the people receiving the 2-dose vaccines get their second dose within the expected time frame. So that means like we already know that there are 2 vaccines, Pfizer and Moderna, they have 2 doses. So Pfizer is basically the first dose is 0, and then 3 weeks later, the second dose. For Moderna, first dose is 0, and then second dose is basically 1 month, that is 4 weeks. So that's the earliest you can get, I mean, anyone can get. So the goal is basically 95% of the people, 2-dose vaccine, they should get in this window period, like 0 followed by 3 weeks, second dose for Pfizer, and 0 followed by 4 weeks for Moderna. And J&J, this is only 1 dose, so which is good for the people, who have a needle hesitancy, who have like, some other barriers, such as like they cannot come to the second dose for their vehicle problems, or let's say like a like geriatric population, especially who cannot come for different times. So for those people, J&J is a good choice. But however, it's very hard as I'm working for these things. People act like J&J acceptance rate for the general population is very low. I can say literally 2 to 3%. So why? Because when it started, like there was a very bad rumor about clot. and its social media did a very bad job about spreading the news. So it can spread very it spread it very badly, and still it's very hard to overcome that news. But still, healthcare workers are working towards it. And one advantage for J&J is because it's only one dose, so there is no chance that, I mean, one shot and you are done. So it's the non-compliance rate will be very low for J&J, but the acceptance rate is still very low because of the the side effect and all that. What the third goal is zero disparity. So that means there is no disparity in vaccination rates across racial and ethnic groups by social vulnerability index. My next slide, I'm going to discuss about a little bit about what is social vulnerability index. And probably that will be easier to understand. And no Michigander should have to drive more than 20 minutes to reach vaccination site. So that's another thing. Like, if people think that I have to drive 1 hour and then I have to stay in line for 2 hours, which people refuse vaccines. So these are the things we have to work on, because this is one barrier that people are not getting vaccines. So it should be like, that's why now all the big supermarkets, even Meyer, Kroger, they are distributing vaccines. So, people come for grocery, or people come for like, haircut or something like that, so they can have the vaccines at the same times. So that's the goal, but let's see where we are now. So here you can see that how many people got vaccines at this point. So 52.3% of the total Michigan's people, residents of the Michigan, got like the completion of the 2 vaccines. So still our goal is always remember 70%. So to reach the, in order to reach herd immunity, at least 70 to 80% of the people has to be vaccinated. So we are still in 20, literally 20% lack. So we have to work on that up to next fall. That's the whole goal, I think, and which is like already today is July. So this data I collected, this was updated since yesterday, I think. So we have to, like, now you can understand the importance of, the overcoming the vaccine hesitancy. And still 20% or literally like 50% people are vaccinated, and rest of the 50% are not vaccinated yet. And to reach the herd immunity, we need another at least 20%, 20 to 30% people has to be vaccinated. And of course, the other 10 to 20% people will never vaccinated because probably they have some medical contraindications or some other contraindication which they will never qualify, and or probably the children like below 12. So these are the things that I was talking about in the previous slide, social vulnerability index. So this index is very important. It's basically a tool that uses like a data to identify and map places where a community may have difficulties preventing the human suffering and financial loss in a disaster such as COVID. And this is a very important in responding to incidents in an equitable way. So not all populations are equally at risk occurring COVID, right? Because that's how we know that people who are in underserved area, who have multiple comorbidities, their mortality rates are high and they are suffering a lot. Why? Those are the social vulnerability index, like the tools, that's how it, we can quantify, and those are the people who are suffering a lot. So the tools are what? The socioeconomic status, family composition and disability, minority status and language minority, housing type, and transportation. So that's why social vulnerability index is very important, because it identify like, what are the vulnerable populations and why their mortality rate is so high. So those are the all tools to identify, their incidence, prevalence, and mortality rates. So here it's the continuation of the previous slide. So the countries in the state where the greater social vulnerability index, such as Detroit and Grand Rapids area, for instances in Michigan, had higher COVID-19 incidence and mortality, as I said before, because of the higher social vulnerability index. So this is the top 3 counties with the highest COVID-19 incidence rates, and the top 3 with the highest mortality rates had higher level of social vulnerability index. So before like before submitting this grant, I collected this data as well, because it's very important tool to identify that what are the population will have the vaccine hesitancy. So basically, where the social vulnerability index is higher, those peoples have more vaccine hesitancy. It's like directly proportional. It makes sense because probably they are the like undereducated people who does not have much idea about the vaccines and also the pathophysiology of the disease. That's why they are disconnected from the science. Also, they are disconnected from the they are not able to taking care of their chronic health. That's why they have multiple more comorbidities, and which will putting them for a social greater social vulnerability and as well as higher mortality. So every state and every county have this data. Anyone can go and access this data if you need to, if you are interested. So what is vaccine hesitancy? So vaccine hesitancy or anti-vaccination, that is basically unwillingness or denial to be vaccinated despite the accessibility of vaccination surveys. So we have the vaccine surveys, but still people are denial. That is basically the hesitancy. And it is basically recognized one of the most crucial global health threats in COVID era and beyond. And there are multiple factors associated with this hesitancy. Excuse me. So first, mistrust of the vaccine. So we all know that mistrust plays a very important role to vaccine for the vaccine hesitancy, because they don't trust the science, and they do not have much enough information that how vaccine works, what's the role of vaccines, how it's beneficial, what is its importance. So those all creates the mistrust, and they cannot. So as a healthcare worker, it is our duty to develop the trust and overcome this hesitancy. Same thing like lack of assurance from the healthcare provider, because also they trust the healthcare provider the most. So like it's our duty to convey them the message that how it works and why it is so important for him, for the community, and for the families. And an individual may or may not understand the value of vaccines. And another thing is the individual may understand the importance of the vaccines. However, he or may not have the access to the vaccines, such as different reason. Probably a geriatric patient have multiple comorbidities. He cannot drive. He is in a nursing home bound patient. So, that's one barrier or accessibility. Somebody probably might not have like probably might think, oh, vaccine is, they have to pay for the vaccines. So those are different type of like multiple like barriers in order for the hesitancy. So, but vaccine hesitancy is a key contributing factor for the re-emergence of the new infectious disease outbreak and increased mortality rate from the vaccine preventable disease. So that we all know that why the polio does not exist in the world now, because it has vaccines. Same thing with measles and hepatitis A. But if the vaccine hesitancy is higher day by day, or people don't vaccinate us, it will again re-emerge and we are going to inviting in another outbreak. Same with mortality rate. So here are some samples questions which I collected from my project, and while I was working with my the community, I collected those questions and how I counsel them to how I counsel them and how I make them convinced to get these vaccines. So here are some examples, such as like a 17-year-old boy stated that I'm healthy and young. I do not think vaccines are necessary for me. Even though I get COVID, my body will be able to tackle this. So how we are gonna these are the suggested intervention, or how I'm going to convince them as a healthcare worker. So as we always have to emphasize, the vaccines are highly effective and prevent someone from severe disease. So his thought is like, his mindset is like, I'm healthy and I'm young, why I need the vaccines? Yeah, that's a good question, right? Like why he believes that he doesn't need a vaccines. But like he only believes that part. That's his mindset. So it is our duty that we have to emphasize the vaccine is very highly effective, and it can prevent from someone a severe disease. he might get vaccine. He might, if he doesn't get vaccines, still he can get vaccines, and it can be a severe illness. So we can prevent that from giving the vaccines. And we have to educate how every vaccine contribute to developing herd immunity sooner than later. Vaccines are the only way to get back to the normalcy, and regular activities such as sports, tournaments, graduations, get together, etc. So, these are the young people. So they are very careful. I mean, they are very excited about their tournament, or their, let's say someone is a like basketball player. Now that no one wants to play basketball while wearing the mask. So, so we have to go by their situation and their choice. So we can counsel them like, hey, this is the only way that we can we can reach the herd immunity soon, and also we can get back to the normalcy as soon as possible. So this is the young person perspective. Let's say how a middle-aged woman asked, yeah, I have high blood pressure and diabetes. I will take only Pfizer vaccines as per my BCP's recommendation. So see, like the question, type of question is different, and like every people have different things. So, at the same time, I have to acknowledge like what he said, and that's a, first of all, like we have to respect their time and their questions also. I have to acknowledge that. So we can just say that, hey, there are 3 vaccines approved for emergency use authorization, such as Pfizer, Moderna, and J&J. These vaccines are equally safe and effective against COVID virus, and there is no data available at this time point that indicates any of these vaccines are contraindicated for those with multiple comorbidities such as hypertension or diabetes. So whatever we have, like, we always have to be very honest about it, and we have to always acknowledge whatever we do not have. So basically, we do not have any data available that which vaccines is more efficacious people who have multiple comorbidities such as blood pressure and diabetes. It seems to be like J&J only contraindicated who have a blood clot history in their family, or a sudden death, or like any kind of immune thrombocytopenic disease, something like that. But there are multiple comorbidities, all of them are equally effective. So we have to just counsel them regarding that. Let's say what a young woman. So a young woman was curious and asked, does the COVID vaccine prevent me from getting the virus, or will it decrease my severity if I infected with the virus? So this question is very like, basically her concern is like, it is prevention or the severity. So, a fully vaccinated person may reduce the infection rate by more than 90%, and it also reduces the severity of the illness. So basically, it can reduce the severity of the illness, and also it may reduce the infection rate at the same time. So my next question is, while this is very interesting questions that I always face with the different people, that when getting someone like for the second dose, a middle-aged woman asked 4 to 5 days after the first dose that I did check my antibody level, and it was positive, which means 1 dose is enough. So what's her question was that she got the first dose, and after 7 days, because first dose and second dose, the interval is basically 3 to 4 weeks. So in between, she went to a PCP, and she asked her PCP, can I check my blood level to antibody to see the antibody is positive or not? And it seems that, they check and it comes back positive. So he wants to know, then I'm antibody positive, so I don't need the second dose. She came for the second dose, and she's asking, I don't need the second dose, and probably this first dose is enough to make the antibody. But she doesn't know what does it mean. So first of all, it is not recommended to assess the immunity by checking antibody level after the vaccination, the first dose. It's not recommended by CDC. So we have to counsel them that, it's whatever you did, that is not basically recommended. However, the positive results indicate that you might have had COVID infection in recent prior without any symptoms, or so basically what happened, probably she had a COVID infection, asymptomatic COVID infection, and that's why she developed the antibody, and that's why her antibody test is positive, antibody level is positive. It is not because of the vaccines. So, but she doesn't probably understand that because it was asymptomatic infection. But still, she should continue to practice precautions such as masking, hand washing, and social distancing to prevent the spread of the infection to others. Because basically, as per CDC, first of all, it is not recommended to assess the immunity, and also the antibody should appear after the second dose, I think 3 to 4 weeks later, but still it is not recommended to check the antibody level. But she already had the antibody, means probably she got COVID infection rather than the vaccines. So that's still the underserved communities have limited access to COVID vaccines and testing facilities, and which will be very difficult to reach for the community to develop herd immunity. But still we have to work hard, and we have to try our best to reach that. At this point, it is very important that the healthcare team should address the barriers to vaccine hesitancy and educate the underserved population regarding their vaccine safety and efficacy. So in that way, they will take the potential power over their own health and prevent and control the spread of the disease and save lives over time. So that's my understanding from these whole things, because I feel like if they know what is it, the pathophysiology of the disease, if we can educate them how vaccine works, what's the importance of it, they will take care of it. We don't need to take care of it anymore. And thank you so much.
Thank you so much, Sumi. That's a really great presentation and summary for your great project. So thank you. Any questions, or should we go to the next presenter? So if there is any question, please use the chat box, and if the next presenter is ready, we can share the screen and start the next section.
Sure. Thank you.
Thank you.
Assalamu alaikum wa rahmatullah.
Alaikum assalam wa rahmatullah.
My name is Ram Osman. I'll be doing a presentation about SPSS, but I will need permission for sharing the screen.
Now.
Okay, let me see if it's on. Okay, so my screen is visible right now, or not yet?
Not yet.
Okay, let me try again. Is it visible? It should show a the PowerPoint, but let me check again. Okay. Okay. Well, let me go back to the Zoom and make sure I share the screen properly. Okay, I'm pressing on share screen. And okay.
Try. Let me make you. Oh, now it's coming.
It's coming.
So
yeah, my screen is visible now.
Yes.
Okay. Alhamdulillah. Bear with me, guys, because this is my first time.
Take it easy.
Technology always will fail during the presentation. So, alhamdulillah. So let me start my presentation by a short PowerPoint about the SPSS. Okay, so alhamdulillah, after I volunteered to do this SPSS, I was really scared about this. I have zero knowledge about SPSS, but alhamdulillah, what I came after I did this studying for the past few days about it, it is not a scary program. It is something that you can handle, and something just need to know more about this program. Okay, so the basic thing that I'm going to teach in this tutorial is to how, because there is studying SPSS is very, like it has so many aspects, but I chose something that is close to our study, that most of us will use a questionnaire. So what is the next step after using the questionnaire? So the next step after using the questionnaire is basically gathering the data and entering your data into the SPSS. Okay, before I begin, I would like to share this short video. This video is just 1 minute video showing an overview of how SPSS is actually used in healthcare. It's not a long video, but it is informative if you can follow along with the video. I chose it because it's a very short one, but it has a lot of information if you can actually follow and read how many aspects the SPSS is used right now in this day and age for healthcare. Okay.
Excuse me, I can't hear the video. If anybody.
Okay, so it's just a short video, an overview of how IBM SPSS statistic has helped a lot in basically in healthcare. So it is involved in basically almost everything in healthcare these days. I don't know. So, okay, so let's go to the basics and learn what is SPSS stands for. Um, most of us, we heard about SPSS. Me, I didn't know what is SPSS stands for. So the first thing I went and checked what is SPSS stands for. It stands for a statistical package of social sciences, a statistical package for social sciences. But now we're doing research and we're thinking like social sciences. What does social sciences have to do with research? Actually, when they started this package or the statistical program was developed by SPSS INC, it was mainly used for behavioral science, psychology, all these things to analyze those basically questionnaires. But 2009, IBM bought this program or acquired this program and became part of this industry. And they changed the name to IBM SPSS Statistics. They changed, so that's why it is not called SPSS anymore. It's called IBM SPSS Statistics. Okay. To make this presentation more simple, our focus is now how to actually, there's two things to do in the SPSS actually. There is the data entry and the data analysis. The data entry is looks like is more complicated task if you compare to the data analysis, because the data analysis, all you need is go through the drop down menus and just play with your data and or like do all kind of studies, statistical studies, of course, in your data. But the data entry, if you enter it correct, this will basically prepare this software for you to do all kind of study. So these are the main tasks can be done through data entry. There are common tasks and there's advanced tasks. There are common tasks and advanced tasks. The first three are common, which is entering variables, example like entering height, entering weight, and sometimes we define separate groups within those variables between subject factors, example the gender and the level of education. Also entering repeated measures within the subject or the factor. If you are advanced in SPSS, you will be able to do multiple separate groups like the gender and a level of education in the same time. Okay, or do separate groups and repeated measures, example the gender and time. Okay, so and also with the task, which is a little bit advanced, is creating dummy variables within the SPSS. Okay. Let me go back. And the process of data analysis, let me see. If somebody can help me with this PowerPoint, because the view of the cameras is blocking my view, but I'll try to read this. Okay. Let me see if I can go back. Okay, so process of data analysis is simple compared to entering the data. So and this run on the analysis, and you can analyze from the menu. But data entry, this is the one we're going to talk about today more, inshallah, because we're going to have a questionnaire that we're going to enter in the tutorial. Okay, let me break from this view and end this show. And this questionnaire, I chose this questionnaire because we are going to be familiar with this questionnaire. If you remember from the first presentation with Dr. Ali and Dr. Lubaba, Dr. Ali presented this questionnaire, but I took a small part of this questionnaire, and this is the part we're going to enter to the SPSS today. Thank you for the red team. Thank you for Dr. Ali for allowing me to use his questionnaire. So if you can see, this is not the whole questionnaire. This is only a section of his questionnaire with section 3. And this is the accessibility to the vaccine. So I numbered here the questions, and I just added question 1, question 2, question 3, 4, and 5. And then if you notice, instead of just leaving them as choices, like no, 1 dose, 2 dose, I numbered them. 1 is no, 2 is 1 dose, 3 is 2 dose. So when you do your questionnaire, make sure you do this, because this is going to make your life easy when you enter the data into the SPSS, doing it like this way. And in a minute, I will show you how this is easy. Okay, so I'm going to try to make this smaller and just keep it to one side if I can be successful in this today. Okay, and then let me open the SPSS. Okay, so this is what you're going to see. This screen right here, what you're going to see when you open the SPSS. Okay, so let me make this a little bit bigger before we start our presentation. Okay, so you guys can see the screen, the whole screen for.
Yes.
Okay. Yes. So now, before I enter any data, I want to talk a little bit about this. Okay, so there is 2 modes of views. 2 modes of views. What are these 2 modes of views in this screen? The first one is the variable view, which I think is important, more important than the data view, because if you fix everything in this variable view, the data view is going to be really easy. So you are actually preparing the data view by entering all the information that you need through the variable view. Okay, you can do it vice versa, but this is not the easy way. Go to the variable view first. Okay, so let's look at this questionnaire. How I'm going to transfer these questions into here. So first, this variable view is like Excel's the same thing. It has the rows, okay, and it has the columns. Okay, so let's start. I'll make it really easy. I'll just enter, instead of entering the name, when you guys see names here, this does not mean a name of a person. This is the name of the variable. Okay, so how you enter the name, and we know this from the last presentation of Dr. Hadil, we have certain criteria. We don't we have to start with a letter, and there is no space. The only thing that you can use is an underscore. Okay, and you have to start with the letter. And I think the maximum number of variables you can put in the name is like 64 characters or so. So there is no space, no special character. The only special character you can use is underscore, and you have to start with the letter. But anyway, the program will stop you anyway if you do a mistake. So let me start by here, by doing the first. So here I'm going to enter the questions that I have. I'm going to show you one, because this is basically really boring to watch. But so I'm going to show you one row, and then after that I'll show you another screen that I have all the data entered already. Okay, so don't think I'm going to enter the whole questionnaire, so bear with me. So okay, so this is question 1. Okay, and this is, I'm going to do the whole thing. Question 2. Okay, sorry. And then question 3 until question 6. Let's do it like this. So now, once you enter it, now there's something that comes that pops in automatically. This, okay. Okay, some stuff will pop automatically. Let's see what are these things. Okay, because this is important to know, because you're entering the variable view to prepare the data view. So far, let's see what happens to the data view. I want you to understand that variable view controls data view. So whatever I put there is going to appear here. Question 1, 2, 3. Okay, so let's go back to the variable view and see what we're doing. So let's see question 1. So question 1, the type of this question, we can consider it numeric because we are using number. Okay, so what does this 8 width mean? 8 width mean that we need 8 character to fill the cells. These cells, no, they're not talking about these cells. They're talking about the data view cells. Okay, so the width of the cell in these cells, not in the variable view. Okay, so you're allowing 8 characters. Okay, and you are allowing 2 decimal. When I say 2 decimal, that means only 2 decimal. For example, if I put 1, it's going to be 1.00 because I allowed only 2 decimal. But you're going to understand what I'm saying. And when we go to the data view after we fill all the data. Okay, so now label is very important because we're using a questionnaire. Because right here, nobody understand anything. What is this? Like just 1, 2, and there's nothing. So what is question 1? So here in the label, you can write down the actual question. The actual question. So what I did is just to copy and paste the question to make it simple. And the label, by the way, is not like the name. The label, you can enter anything that you want, okay? It's not like you have to put certain thing and you have to start with number. So for the sake of simplicity and for this presentation, I'm just gonna copy this from my questionnaire to make it easy for everyone and just paste my question here. So this is the question, okay? So this is a descriptive or a label of what I am doing here, what I'm doing here. So now, where is the answers gonna go to? Where's the answer? So if this is the question, where's the answer go to? The answer goes to the value. The value. How do I enter the value is very, very straightforward operation to do. So we just click here for 1. I'm going to enter 1 and I'm going to describe what is 1. 1 means no. Okay. And we add. Okay. Make sure you add. And then what about 2? When the participant or the patient or the case answer 2, what does 2 means? 2 means that he had 1 dose. Okay. 2 means he has 1 dose and we add it. Okay. And then 3 means he had 2 dose. Okay. So, sorry, I have 2 doses. 2 means he have, or 3 means he have 2 doses. And this is how we add what is the choices in the question, or what is the varieties, or what are we studying the questions, the different variables of this, or the answers for the question. So make sure you press OK, because I did this mistake before by just crossing this. If I put cross, everything will disappear. All my work that I just entered will disappear. Just press OK. Do not press just the X. Okay, so if there's any missing things, you can put missing things, but there is none missing things. Okay, and this will give you the number of the column. And aligning is just align your words to the right or to the left. And this is usually to the number. Do you want them aligned to the right or do you want them aligned to the left? So the measure here, since I'm doing 1, 2, 3, should be nominal. Okay, I'll just choose nominal because I cannot measure this. An ordinal. Let me talk about this a little bit, the measures. Okay, so how we know if it's a scale or it's an ordinal or it's a nominal? Okay, a scale is something that you can measure, and that's why they gave you this this measurement tool or a ruler that you measure. If something that you can measure, like height, like weight, you put scale. If something that you can rank, Okay, like for example, how you can rank. For example, when you have a questionnaire saying that 0 non-satisfied, then little bit satisfied, then great, then moderately satisfied, then greatly satisfied, you can put this in rank, right? So this is ordinal. This is ordinal. And then nominal, if something that you cannot measure and you cannot rank. For example, you have 5 colors of balls that you're studying. So green, blue, yellow, for example, you cannot rank them. It's just, this is a nominal. So this is how to do this. Now let's go to the data view and see what happened to these questions that I entered. Okay. So now still there is nothing because I didn't finish this variable view. I have to finish everything, okay, and then go to that one. So for the sake of simplicity and you know, not boring you guys out on this presentation, let me do a data that I already entered. So I spend the time here in this view. I don't need the questionnaire anymore. So I spend the time to enter. Let me go back. This is blocking my way. Let me see. Okay. You know, I can tell I'm not good with technology, but I will try. So what I'm trying to reach is this icon here. Okay. So this icon here will shift these entries that I entered from the data view from the actual, what does it mean, on only the answers. Okay, so what is this means? This means that subject number 1, or the first patient that I filled the questionnaire with, in question 1, he chose the first answer. In question 2, he chose the first answer. Okay, in question 3, he chose answer number 5. In question 4, he chose answer number 1, and like that. So question 6, he answered number 2. But sometimes we want to see what they actually answered. So we go back to this and click and see what is the answer. So in question 1, he said no, he didn't take the vaccine. Okay, so the second answer was AstraZeneca. So because I entered this by myself, you're going to see some mistakes here. Because of course, if he answered no, the second question should be no also. So the third question was no, and then yes, and he said he thinks that the primary care clinics only carry the vaccine, and the last question. So you can always go to back to your questionnaire, or you can view it like this. Okay, so if you notice here, I left this intentionally because this is a mistake that I did when I entered the data. Okay, this mistake showing 5. 5 is not the answer. 5 is just the number of the answer, and it's not the answer. So what happened? I need to go back to variable view and see what mistake did I do when I entered the values. So let's go to variable view. Let me go back again and see which question is this. This is question 2. So I'll go back to question 2 and see what mistake I did. So let's go back here and check and see how did I enter this one wrong. So it was question 2. So I need to go back here and see how did I enter my values wrong. Okay, I maybe missed something. So see here, I found that I missed totally answer number 5. I missed answer number 5, so I can add it now, which is, I say 5. And I think the answer number 5 for it was no vaccine, or I did not take the vaccine. So I'll just put none for that and add it, and don't cross it, put okay. So when you press OK, now I go back to my data view and see. Now it is fixed. So they say they have no vaccine. So I did not choose anyone because they didn't have the vaccine. Okay, so after we entered successfully these data, and I filled it randomly, you know, for 30 patients. So my, sorry, I need to scroll down. So my sample size here is 30. So I filled it out for 30 patients or 30 participants for this. So what's after entering the data? Now we're excited because we can do analysis. Okay, so the drop-down analysis will show you what kind of analysis you can do with this data that you entered from that questionnaire. Okay, so let's say we want to, there's so many types of statistical study that you can do. So I'll choose, for example, frequencies. Okay, so what I'm going to do with frequencies, For example, I wanna, let me talk about this pop-up window. You choose what you want to study from here and you put it there. You can actually click and drag this, or you can highlight it and take it here. For example, you're going to highlight the vaccine availability. When you press here, automatically it's going to go to this window. Okay, and you press OK. So I want to know the frequency of the vaccine availability, or I want to know the intention of getting the vaccine. So I can turn it from back and forward, back and forward from this screen to this screen. If you want to add it, you put it here. If you want to put it back, you just go back here. So let's say I'm studying this factor. Okay, I'm taking it here, and I want it to be through charts, because I want to view it as chart. Maybe this is the way I want to view it easily. So I use chart. Okay, and what kind of charts? I want to use bar charts. I can use pie charts or histogram or none chart, but I'm choosing bar charts, and I will continue. Okay, let's see what's this gonna show me from the charts. Okay, so hopefully it's gonna come up. Let me see. So this is giving me the number, the valid number, which is 30. I have no missing data here because everybody entered the data from the questionnaire. So let me see the frequencies from my sample size. So the people who said no, I did not take the vaccine was 18. There were 18 people. Out of 30 people, 8 people said we took the first dose, and 4 people said we took the dose number 2. Okay, so here the percentage will show me the percentage. This 60% of my samples, they did not take the vaccine. 86%, this is cumulative. So let's say 60% did not take the vaccine, and the 26% took the dose number 1, and 13% took dose number 2. Okay, so now it's going to show us our analysis through bars. Okay, so here we can say that the majority did not take the vaccine. Okay, and then this is how much percentage, or how many people did not take dose number 1, and this is dose number 2. So what I'm trying to say is you can analyze your data. Once you enter your data in the correct way, you can analyze it in so many ways. Okay, you can analyze it in so many ways, and then depends on what study you want to do, you can run through the SPSS. And the thing is, you need to get familiar with the program. You need to get familiar with the program so you can actually find out about all these things, because you can see here this drop down menus. There's so many things that you can do in this program, but unless you actually download the program and start working with it and watch tutorials, because this is a wide variety of tutorials are found on YouTube, and so many classes are done for this SPSS, because you can use it almost in everything. You can use it to analyze your data in everything. So inshallah, my presentation was clear and you guys benefited from this. And my only advice is try to download the program and start, because if you don't start, it's going to be something that is vague and you don't know about it, and you're not going to be encouraged to learn about it. But once you have the program, then you're going to start and basically do things with the program. The other thing that I did not mention earlier is how to get the program. The thing that I found is, if you are a student or if you are a faculty member, this is provided to you by your university for free. So you can go and download it to your PC for free if you are still having an active student ID. If you, for example, went for a certificate program, or you're pursuing a master's degree, or you are faculty, this is provided for you from your university for free. Otherwise, you can get a discount from the IBM SPSS website for students and for faculty as well. If you don't have none of these, and you really need it, you can use The free trial is for 1 month, and after that they will contact you if you want to continue. And I think the regular price is around $99 or $100 per month if you really need it. But of course, everything is there on. You can Google it, and you can Google free download, and you're gonna find some free download for the older versions of SPSS, but you download it under your own risk. So this is not an advice, but this is just a piece of information that there's some websites will download it for free. So, but you have to be careful with your computer. Thank you very much for following up with the presentation. I hope it was not boring. Inshallah, this presentation is useful for you, for all of you guys.
Thank you so much, this is really great. Thanks for sharing and explaining, and this is really helpful tutorial, similar to the tutorial Dr. Hatil also shared with us last time. Excellent, good job. Thank you.
Thank you.
All right. Any questions so far from, okay. Tamador, please go ahead.
Hello, everyone. I just want to say something for WIAM. It is really an excellent presentation. I really enjoy it. And before I had like barrier from SPSS, and now I think it is clear. I just have to try it myself. And let me tell you something, WIAM. You have really teaching, like an excellent teaching ability. You make our life easy. Thank you.
You're welcome, Tamador. I'm really happy to hear this. Thank you for your words of encouragement. Thank you very much.
Thank you, Ali, please go ahead.
Hello, everyone. I would like to thank WIAM for this very nice demonstration and this very helpful tutorial. I would like to add one comment, maybe it would benefit you all, regarding the missing variable. It would be helpful if you categorize your missing data by any random number, for instance, 999 or anything, because if you are working in a team, someone would ask, did you have you not filled the questionnaire yet? Or maybe it's empty because you didn't enter it, or it's intentionally empty. And also, it would help you with the analysis, because if you leave any variable blank, that would be an issue for analysis. So it would help you a lot. Thank you all, and thank you, WIAM, again for this very nice demonstration.
Thank you, Ali. That's also a nice comment and very important point. Thanks for sharing. Any other questions? If not, if you have questions, guys, you can use raise hand from the menu down at the bottom. If not, we can go ahead to the next section. Azza, please go ahead, and then Muhammad Al-Fadil, if you have questions or comments.
Yes, thank you. Thank you, WIAM, so much. That was useful, concise, and very clear presentation of SPSS. And I would just, I wanted to point out there's a few questions in the chat box for WIAM. I'm just moderating the chat box here. I think the first question was from Sulafa. She's asking, can we import the file only instead of entering the data one by one? And because some of the data could be huge. And another question is, let me see. are we able to do blocked branch in SPSS to make sure that the questionnaire is short? Thank you. I just wanted to point out these questions before we move on to the next section.
Okay, I can answer the first one, but I don't know about the second one, to be honest. The first one, yes, we can import data. We can import data from Excel. We can import data from another statistical program like like SAS. So yes, we can import the whole data, and I don't think this is a from the Dropbox. If you go to data and you can check import data, and then another Dropbox will come and you choose which program you're going to use to import the data. So yes, we can import the data. Blocked branch, I'm not familiar with it, but from what I read about the function that the SPSS can do is grouping or making groups of variable, or if that's what you're saying, the questions. So I think this is a function that also can be done, but the exact way of doing it, I'm really not familiar with this. But inshallah, maybe we can do more presentations and we can explore this part exactly to answer your question.
That's great. Thank you, Dr. Gam. So Abdul Mahmoud is asking the person who asked the question. So I think you are referring to the branching of the questionnaire. Like if the first question is, did you have the vaccine? The answer is yes. So you go to what type of vaccine. If the answer is no, then you go to a different section of the questionnaire where you will ask why you didn't get, then you mention the reason. If that's the case, then SPSS doesn't go into that details. You can format your questionnaire using Google form, for instance, where you can put the first question, and depending on the answer for that question, you can divide your rest of the questions into part 1, part 2. So if the answer is yes, you go to part 1, this branch 1. If the answer is no, then you bypass that section or part 1, you go directly to part 2. By that, you can shorten the question that the person who answers the question will just spend time on the questions that they pertain to them, if that's your specific question. Thank you. I have answered that question. Any other questions? Okay, Muhammad Ali.
Okay. Yes. Assalamu alaikum wa rahmatullah. Thank you for the presentation. I just simple question like, is the same program that can change all the data that we entered into charts or pie charts, something like in column? Same this SPSS?
So SPSS and Excel are both can work the same. You can put the data in a spreadsheet where you cell kind of column and lines or records. And from all this data, you can create a graph, a bar, or a pie, or other types of graphs. SPSS can do the same like Excel, but SPSS has advanced tool where you can use statistical test to analyze the data. And after you analyze the data, you can present it as a graph that you can present in your poster or papers, or how you use it in similar presentation like what we are doing now. So yes, SPSS can create this graph similar way to the Dr. Showed us the bar graph, and that can be also done with using other software like Excel, for example, or other tools. Thank you. Good question.
Thank you.
If there is no more question, then maybe we should go to the next section of this meeting. Who's going to present? think Dr. Anna Al-Khadir, if she is ready. Anna, hello? Yes. If you can raise your voice a little bit. Can you raise your voice a little bit more?
Is it appropriate?
Go ahead, Anna. Okay, you are able to share the screen. Excellent. Alaikum salam. I think your voice a little bit. Can you bring the mic closer? Thanks.
Okay. I'm Dr. Amr Khadir, and I'm going to present a short presentation about case control and cohort studies.
We can't hear you, Amna.
Can you hear me now?
No.
We can hear you barely. If you can just raise your voice and bring the mic a little bit closer. Thank you.
Okay. Can you hear me well? I will begin my talk by defining the case control study. And it's a type of observational study in which two distinct groups differing in the outcome are identified and compared on the basis of some supposed causal attribute. In case control studies, we compare two groups. We already have the outcome from the start. Like if you want to study the relationship between smoking and lung cancer, for example, we already had the outcome, which is lung cancer, and we have two groups: people with lung cancer and people without lung cancer. And the causal attribute here is smoking. So we identify our group and split them into cases from control, and we measure how frequency the cause is present in each group. Okay. It's usually used to identify factors that may contribute to a medical condition. Like shows here, we have cases and controls. And within the cases, we have two groups. We have exposed group, which is smoking, and unexposed group. And in control also we have exposed and unexposed group. What I just said, and we look back in time to learn which subject in each group has exposure, comparing the frequency of exposure in the first group with the control group. Here, the important thing that we keep in mind when we do selection, controls must be from the same population of the cases. I mean that if we select our cases from the community, the control should be from the community. We can select cases from hospital or communities or any other places, but we would make sure that they come from the same population. And the selection should be independent of the exposure of the interest. At the beginning of the study, we don't know the one who smoke from non-smoker. We just have cases and controls. So the exposure, we don't know about it at the beginning. Okay. And the third point, that the number of cases and controls doesn't have to be equal. Actually, instead of that, if we have more controls, like for example, if we have 4 persons in control group matched to one case, we will increase the power of our study. Another important point that we should have a clear case definition, by which I mean that if our case is from cancer patient, we should have one unique diagnostic criteria applied to all cases. Like for example, if we use for diagnosis histological examination, we should apply this diagnostic criteria to all cases. And source of cases can be recruited from a number of sources, for example, from hospital, from clinic, from population. Another important thing in case control studies is matching. And this is used to attempt to ensure comparability between case and control and reduce variability as frequencies due to background variables that are not of interest to the investigator. For example, we match our case and control together by age, by sex, by other means, so that here we reduce the risk of confounding. Okay? Each case is treated individually paired with a control subject with respect to the background variables. The exposure to the risk factor of interest is then compared between cases under control. By matching we reduce confounding, which is a confounding factor is a factor that associates with both the cases and control, and it may create a false association between the case and the attribute factor, which actually is not there. For example, if we had a study that measured association between alcohol and lung cancer, and we here we didn't did matching by, for example, smoking, we could have a wrong conclusion that alcohol is associated with lung cancer, because here people who drink alcohol are more likely to smoke. So smoking here is a component factor. So if we match by smoking, we will reduce the compound effect, and the conclusion will be there is no association between alcohol and lung cancer, which is the correct conclusion. In case control studies, we do that analysis using 2x2 tables. We have our cases and controls and exposure and unexposure. And we calculate the frequency of each of the measured variable in each of the two groups. We measure odds ratio. It is a measure of association of the risk factor with outcome. And then we calculate the confidence interval. This is calculated, these two calculated through the 2x2 table. An odds ratio is the ratio of the odds of an exposure in the case group to the odds of an exposure in the control group. And then we calculate the confidence interval of each odds ratio. And if the confidence interval that includes one, means that the association between the exposure and outcome would have been by chance, and our result is not statistically significant, and there is no real association between the cost and the outcome. Case control studies have many advantages. It's a quick study. We can write in short time and be expensive and easy to conduct. So it's useful in our case where we don't have actually enough time to conduct large studies that take time and resources. And also it's useful for the study of rare disease when there is little when it is not about the association between risk factor and the disease. And also we can find multiple exposures. Advantages of case control is study that is subject to many biases, like selection bias, because if we select our cases from the hospital, it's not represented in the whole community, so population base are better than hospital base. And it's subjected to recall bias because it is retrospectively in time. We already have the outcome, and we ask the exposure of the past. And different people have different abilities to recall information, so we could have recall bias. And also there is observer bias because the investigator already knows the study and the exposure and the association, so it may affect the way we conduct this interviewing or questioning the cases and controls. Another disadvantages is confounding, and I talked about it earlier, and this is minimized by matching. It reduces only an odds ratio, which is an inferior measure of the strength of association compared to relative risk, and it cannot provide any information about incidence or prevalence. Cohort study is a particular form of individual study that samples a cohort. A cohort is a group of people who share common characteristics or experiences, like living together or subjected to certain medical procedures or future if prospectively studied. Example of retrospective study, a group of 100 people with AIDS, here we already have the outcome AIDS, might be asked about their lifestyle choices and medical history in order to study the origins of the disease. And if we do it prospectively, we study that hundreds of people with high risk factors for AIDS are followed for 20 years to see if they develop the disease outcome. Here in prospective, we don't have the outcome, we will know it. Critical characteristic of subject selection is to have both exposed and unexposed group have been selected from the same source populations, like research and case control studies. The study subject selected should be appropriate for the study question and should be generalizable to the population of interest. Our cases here in cohort study should be represented to the whole community, so we can reflect our data as a result later and be applicable to the whole population of interest. To cohort study, we are able to measure the incidence, which is the number of persons in a defined population who develop a disease for the first time during a defined period of time. And also, we can measure the rate of risk, which is more efficient than odds ratio. It's calculated by dividing the risk of disease for an exposed person by the risk of disease for an exposed person. The advantage of cohort, it can assess causality, it can help to find a causal relationship with the risk factor, and you can calculate the rate of risk or incidence, and you can determine the risk factors for conducting a new. Also, the collection of data accumulated by so report error is reduced. For the study, we are continuing follow up our cases. So aggregate in favor, so there is no such appropriate recalling like case control studies. You can examine multiple outcomes together and exclude for investigating their exposures. The disadvantage of cohort studies that it needs a large sample size, and it's subjected to selection bias like in the case control study, and very expensive to conduct, unlike case control study. The disadvantage is that applicable to prospective study is sensitive to occlusion, which I mean that sensitive to loss to follow up. The cases they have persons who may die or may move or may change their number, so they are losses. So it's sensitive to occlusion, and the most important thing is that the rate of occlusion should be less than 20% of the sample. The advantage of retrospective study is that it's susceptible to report bias or information bias because we ask information is a part and people may remember things differently, and you have less control over variables. Thank you.
Thank you so much, Anna, Dr. Anna. This is a great presentation and summary. We had a little bit technical issue for the voice, but I think you did great, and the slides were excellent. So we can follow that. Any questions for this section or previous two sections? Any comments? Any addition? So if you do, just write it down or interrupt me. For the next section, I'm gonna ask a few questions and then we can open the floor for discussion. So in the last 2 weeks, we were thinking or giving you a chance to think about what projects, if you have, do you want to do, like what kind of research project? And to start thinking of that, you need to come up with a research question. On Tuesday, Dr. Hakan, small group of you attended, and we were discussing about how you come up with a research question. There are different ways to do that. And in the app, I added a few videos, so you can go over this. It's less than 5 minutes videos about the steps when you think about a question you want to identify what group of people or patients, and refine your question so that you can get a good question. It shouldn't be a generalized question. So you can view some of these videos. If you have time, you can look at the meeting with Dr. Raza Haq that was done also in the app. Now for you guys, let's just do brain like asking question. If any one of you have any idea or any suggestions or proposal for a project that you think you want to start, we can help you with that. Please, Sarah, go ahead.
Assalamu alaikum, Dr. Nader, and everyone. Thanks for the great presentations. Actually, I would like to propose the idea about the post-acute sequelae of COVID-19. There are two ideas, interesting ideas, like Lubaba suggested an idea about the surviving outcome for the post-acute sequelae for the survivors in the nursing homes. And there's also another idea that was suggested by me that was about the glycemic control and the incidence of hyperglycemia, and follow up, and also how we follow up with the is there any changes in the random blood sugar? Is there any changes in post-recovery in the hemoglobin A1C? And we can compare and contrast that in outpatient and inpatient settings in the geriatric population. So these are just like general ideas that we have, like initiatives we have in mind about the post-acute sequelae of the COVID-19. And we believe that like this is like the new trend or the new direction in terms for COVID research. And we were like, we hope that we can like take part in that. Thank you so much.
This is a good start for brainstorming about ideas. So thank you, Sarah. It seems Sarah and Lubaba were discussing maybe more of you about the post-acute sequelae or results of patients with COVID. So it's a new area where we don't know a lot. So people are studying this group of patients who still suffer some consequences after they recovered from COVID. They came up with different terms, terminology, and they call it long COVID or long haul COVID or hauler. Some other terminology if you want to look at the literature, but still it's early phase, so it's a good idea to investigate more and do some research project in this area. So one of the ideas you mentioned is outcome in nursing homes for these patients. I think that might be an easier one to obtain the data. When you think about an idea or a research project, think about the method. And one of the things in the method is the part where you get your data so that you can use WIAM presentation to get that into an Excel sheet and our SPSS sheet, the data for data analysis. So the idea is great. So where you want to get it, the information, so you would limit it yourself to nursing home. So that's the next step is to refine it so that we can obtain some of the data from there. The second idea, which is glycemic control and hyperglycemia post-recovery and so forth, and you want to compare outpatient versus inpatient, which is also a great idea. The question will be, how are you going to do that? So the next step will be obtaining the data. There are a couple of ways. One of them is you obtain the data from the hospital. So you need to go into hospital record, collect the information from there. The other option is to look at the clinic or the outpatient setting and collect information from there. To get this, you need to understand the EMR, the electronic medical record of the hospital where you want to get the information from, and if it's compatible with the outpatient also, so that you get continuity of you want to follow the patient from the hospital when they get out and follow up with their family doctor. So it's a doable thing, but it will be involving two settings, and sometimes if the hospital is using EMR and the clinic is using different EMR, then you may come across a little bit more steps to overcome. But that's a great one. Osama, you raised your hand. Please go ahead.
So I have a question regarding sometimes we have like multiple ideas and we need to reach out like data for this idea, like retrospective data to analyze some question in our mind. But I don't know how we get that, and most of these fellows here are not working in hospital or in setting of that can reach to get some data, well, unless you have to put like questionnaire. And even if you had like questionnaire, it is very difficult to find where to distribute this questionnaire and from where you can get people for this questionnaire to be answered. So just should be like data. How can we get that?
This is a great question, and actually, this is one of the unique thing about this fellowship, because you can do similar fellowship in geriatric, in endocrine, in cardiology, in anything, but you need to be physically in the building where the fellowship is. What we are doing now is virtual, so you want to do research from home, basically anywhere. So this a little bit of a hassle. We need to think about overcoming this or how to handle it. Last year, what we did, because Sumi is a student at MSU and I'm a faculty at MSU, and we have access to Sparrow Hospital, a local hospital here. So when we had the idea of COVID patients, so we went to Sparrow and they offered us the collection of data, which is basically we asked IT to run a query. We didn't go patient by patient chart. It's just they run a query where they get all the patient who has COVID, all the patient age 65 and above, all the patient who have hypertension, something like that. So we just collected general information. It's not specific patient by patient. So that's an approach that can be done easily at Sparrow, or if you follow, any one of you is connected with an institution or hospital, they can come up with the idea and then approach their hospital and see how they can get the information of the data from the record. Sometimes it's time consuming as far as how you get into that we can discuss that in the future, but for now, yes, it's the second option to get data is look at what there are some available database in the country where you just apply, get already available collected data, and then analyze whatever question you have according to the data that you collected or you obtained from the database. So I suggest if you look at one of the files, I can share the files with you. It's a list of abstract accepted to ACP, American College of Medicine or Physicians. And for residents and students, medical students who submit their abstract and accept it and win the prize for that, I think in 2019. One or couple of the abstracts, they used some of this database, national database way of obtaining data. So for that, you don't have to be with a hospital or an institution to obtain that. Just you write your proposal and what variables you want to get and see if they have this data, and then you collect it and then you analyze. So there are ways to get some data remotely, but most of the research that's done in the past and to get information, I think you need to be physically or connected to the an institution or hospital. Okay, we have 3 questions. Thank you. Yeah, and then us and Sarah. Go ahead.
Yes, thank you. I have a question or a proposal for an idea. And I noticed that whenever we start, of course, this is given, we're going to say something about COVID because this is need to be addressed. And I do have my mother with me at home, and I always had this question: is how did this quarantine affect her general health? Because of course, because she is elderly, she is more, susceptible to the virus, and she don't want to leave. Maybe my daughters will leave. They'll say we don't care during the quarantine, but the old age they will stay because they know they're under risk. So I'm saying, my question is, did this the time of the quarantine, how did this affect the general health of the geriatric population? It's affecting her mental health. It's affecting her actual health because she's not moving around. She's not walking like she used to. I was always scared that she'll be prone to things, other things, due to her not leaving the house. So I don't know how to formulate this, and I don't know how to collect the data for this question.
Excellent question. We'll go to Azza and then Sarah and Abuzar, and then we will come back to explore more. So Azza.
Thank you, Dr. Nadir, and thank you, Sarah, for suggesting our next project. This is very interesting. I have just a few suggestions, since we already are facing data dilemma that we cannot get a data from. We need like a data from inpatients diagnosed with COVID, and we need a follow-up with them, like outpatient data. Can we do something like we get data only from one source? Since we need the end result, we can get the data from the outpatient, like patients who are already being followed, and we look at their have there been recently diagnosed with COVID and the incidence of, and then we can look at the incidence of their hyperglycemia or A1C or elevated A1C. That will like solve a problem of getting multiple source of data. This is one thing. And for WIAM question, I think your point is very valid. In our last year, we had abstract about the incidence of depression and fall in the geriatric population post-COVID. And we get the data from the nursing homes, and there is more incidence of anxiety and anti-anxiety medications. So I think your point is valid. We can do more in this area. Thank you so much.
Thank you, Azza. That's great. So we will come into that also. Sarah and Abuzar.
Hi, everyone. I have a quick question. Can we just go and try to do like other research methods like systematic reviews or article reviews, just to avoid, I know that we're not working like directly in the hospitals collecting data. So what do you think about the option of going to do like systematic reviews and meta-analysis? Thank you.
Excellent. Thank you for the question. And go ahead, Abu Zar.
Assalamu alaikum wa rahmatullah. First of all, thank you, Dr. Wiam. Thank you, Dr. Amna, for the great presentation. Thank you so much. I have a proposal idea, but it is not related to geriatric, but I have to share it with you, and I need your help. So I'm working at a county coroner office, and it is a governmental institution, and we do every day like 3 to 4 autopsies for the decedent due to drug overdoses. Okay, and the age of these decedents range between 20s and up to 70s, and it is a real problem. It is a small county, and we have every day like 3 to 4 deaths due to drug overdose. I want to do a research, comes up with something minimize drug use or drug overdose that to help the community where I live. The issue is that it is a governmental institutions, and I don't think we can allow to gather information from there. And the second issue is every case that we see is already dead, so we can't questionnaire them. So it might sound impossible to conduct, but I have to share it with you, and you have to help me to come with something to help. Thank you so much.
Thank you, Abu Zar, and good question. Thanks. We will address this. Muhammad Al-Fatih. Go ahead. Al-Fadil, Muhammad Al-Fadil.
Yes, okay, thank you very much for the presentation, Dr. Auna, Dr. Wiam. My question is about what about the like the clinical trials and randomized controlled trials. Although I know that we cannot have physical access to patients through the Telegeriatric fellowship, but we can also collect some even retrospective data about the clinical trials. I'm adding my voice to the meta-analysis and systematic reviews. And my other idea is we can also have a look for the previous presentations or previous published work from this group, so we can have an idea about how the research is done, and how like we can get to know how the research is done from proposing the idea till it reached and it sees the light. Because really we don't know. We studied a lot many times about this cohort, this retrospective, but we don't know what's going on like from the beginning till the end, and how people struggle and to get. So we can, if we can just get one or two to discuss it in from those who did that would be great, I think. Thank you.
Excellent. Thank you so much, Mohammed. So let me go over these comments or questions, and then take it one by one. So for as I mentioned, the effect of COVID definitely affect many of us, and for older adults, I think it affects them more. So being guaranteed or being in one location, definitely it has a negative effect physically and mentally. So if you want to formulate that as a question, I think it might be a good idea. If you want to specify, and again, Here you will say the effect of COVID and stay in place and regulations and in all the others. But this is a general idea. So you want to be more specific and narrow down your question. And again, if you look at the videos about how you formulate your question, I think you will have a better stepwise way to reduce that. I will give you an example. It's not a limited example, but so if you want to be specific or you want to refine your question, you can say as the question before that, the effect of COVID on all the adults in outpatient, and then you can identify a geographical area, let's say in Michigan or whatever state or in the Gulf, or and if you want to be more refined, you want to add some ethnic group or minorities, let's say. So it will be the effect of COVID stain or whatever in older adults in this area or this state or that, and then in the group that's basically minority. So your question is very, very, very specific, and then you will think about how you want to obtain the data. And this can be done different ways. One way is you create a questionnaire similar to the way the group are doing about the COVID hesitancy in Sudan or COVID vaccination. So you just create some questions, put it in a questionnaire, and then think about who you want to ask this question and obtain the data and then analyze. So this is one way of thinking about your question. You can think about it different ways, but this one suggestion. As you specifically want to direct Sarah about inpatient versus outpatient, you want her to focus or the group to focus on outpatient. And again, it depends on how you can approach the institution or the clinic or whatever place where this actual chart are located. Is it EMR or paper? And then who is responsible for that place? So if it's outpatient and it has their own EMR and you have some connection, then it will be easier. Absolutely, it will be a good way of doing that from this perspective is after they discharge from the hospital, what happens there. So this is a way, and you can collaborate with this institution if you have some connection. If you have connection to the hospital, you can do it the other way around to collect information from the hospital, but it's going to be harder to obtain from the hospital. Sarah Ahmed mentioned or suggested using ways easier than going for search questionnaire questions about patients. Let's look at systemic reviews, meta-analysis, and do this. So again, this is a very good option and it's doable. So you need to focus your question about what exactly you want to review, systemic review. Is it COVID related? Let's say this is a hot topic, so COVID. And what area in COVID you want to focus on? We want to focus on geriatric. Okay, and what in geriatric you want to focus on? So again, the question is how you formulate your research question, and then you have to look at the literature, and then you have to decide how you want to do the systemic review, and then go from there, collect their data, and then do the whole step for analysis. Abu Zar, you have a very unique question about your situation. drug overdose. So this is a little bit tricky. You work with a government institution. So for you, I think you can approach this with your supervisor or the hierarchy and tell them, hey guys, I have an idea and I'm thinking of doing a proposal, writing a proposal of how to analyze what we have so that we can build a program to educate people out there. It's a way, see if they are open to the idea or if they have connection to lead you where you can talk to other people who can help you in that regard. Sometimes it's the ideas, it's good when it's in your head, but it will be better and beneficial when you share it with others. And I learned that when I was doing my fellowship in Grand Rapids. I had an idea and I was working with attendings and we have some residents with me. My idea at the time is just about educating all the adults about smoking cessation. And my idea was to videotape or ask some questions about those who quit smoking and get a video of how they did it, because they are older, but they did it, and show these videos to my patients who are older and still they are struggling. So it was an idea, and I shared it with one of my attendings, and they actually encouraged me, and they, anyways, to make the story short, I had to write the whole thing in a proposal for a grant, and I got the grant. And I carried my proposal. So if you have the idea, if you can share it with others and then see who can help or direct you, and I think you can find someone who can help you there. Mohammed Fadil, again, retrospective data studies, it's doable when you have the idea and you have the material or the data. But if you don't have the access to the data, it's a little bit difficult. So your other point, which is suggestion to look at what we did, what the fellows did last year, how they finished their projects, I think is a good suggestion. Maybe we can think about giving 5 to 10 minutes in the coming meetings to the project leaders or one of the group in the projects that successfully completed last year. And they can tell us the story from the idea, how they come up, and then the data, if there is data collection, and then how they apply or submit their proposal for the conference and get accepted, and how they present. So that's I think it's good suggestion for Mohammed Fadil. With that, I just want to share very quickly. Sometimes your idea might be good and you can get information, data. What's is also excellent is when you collect as much information so that when you get the data, you will have an option of dividing your data into 2 or more projects instead of just focusing on your data collected for one project and you say that's enough, that's it. If you collect as much information, you can identify more than one question. Maybe your question about older adults, but now you can specify all the others with diabetes, all the others with cardiovascular disease, all others with renal disease. So now your data can support at least 3 projects, something like that. So maybe next couple of weeks we can assign some of the previous fellows to present some of their projects. So I have Sarah and Sarah. So Sarah Ahmed, go ahead, and then Sarah Al Sayed, followed by Mohammed Al Tijani.
Sorry, I have to get my hand down. Sorry, I have no any other question. Yeah.
No problem. Okay, so Sarah Sayed, and then followed by Mohammed Tijani. Go ahead.
Thank you, Dr. Nader. So just would like to answer as this question. So the idea proposed was just like a rough idea, and if refining it will make things simpler and can be like one step, like in outpatient settings only for ease of accessibility if possible, and then we can take it a step further to the inpatient. Then afterwards, like it can be like a series of projects together, smaller projects, but we can complete the whole picture. So like further refinement is absolutely needed. I have a question. So like if you like to access get the access to the data on site, so like do we reach for, like in case of my topic, like do we reach for a geriatrics or an endocrine, or there's like some new clinics opening, like the post-COVID clinics? So like how can we start that?
So there are a couple of options again. At MSU, we have the endocrine clinic, and then the director there, he is running some of the research project there. We can try to contact him and see if we share the idea and if they are interested in doing some research in this area, if they have enough patients with COVID and diabetes. This is one option. For that, I think we will need someone to be physically in. So either myself or Sumi, or maybe someone else who can come to MSU and then follow up with a chart review and collect the data and so forth. So there is a possibility of doing something like that. This is one way. There are different other ways, but for now, let's think in that way. But I agree with that. If you start with simple, I think it will be doable rather than you start with complex and then you cannot do any, you cannot finish all the parts that you need. So if you have a very simple, doable project, that will be great. Okay.
Thank you so much, Dr. Nader. Appreciate
You're
it.
welcome. Mohammed Al-Tilani, sorry.
Assalamu alaikum. Thank you so much, Dr. Nader, and everybody else. Thank you guys for the great presentation. And just for to draw a smile on your faces, everybody, every time you say Muhammad Al-Fadil, that make me kind of get ready to answer the question, because my middle name is Muhammad Al-Fatih, as a matter of fact. So back to business. It's just a question about a point you definitely highlight very well, which is your project would be based upon the data that you can gather. Still thinking of a topic for my research, but kind of hesitant to adopt the idea again, and unless I can find a good source for information or data at least. And I hope either through your Michigan State University or through you or through Swami, we can at least, you can serve as a, if I can put it that way, as an insider that can help us to get some info. The idea having in mind, which is, and I hope we can get to the, what we can call it officially post-COVID, because we're still dealing with the COVID up to this point, trying to think of over-sanitization, the overuse of sanitizations during this year and a half, and how far it affects the severity of common diseases that we used to have before and before COVID, and to which extent these common infections getting severe because of the effect of over sanitization and the immune system, basically. Things like common upper respiratory infections, because this is one of the things I realized. A lot of people I know that just mild cold, they take forever to cure. Same for otitis media and pediatrics. A lot of kids kind of suffering from, they have to use more than one type of antibiotics to cure the otitis media. Even things can go all the way to ear tubes. So this is kind of just an idea, but still, as I mentioned earlier, I'm hesitant to adopt it unless I can at least be able to find a source to gather information. In this case, do you recommend, for instance, using antibiotics or more than one type of antibiotics to cure the common infection? I can use it as measure to measure the severity of the infection, comparing the pre-COVID treatment of the same diseases in any population. It can be geriatric, it can be adult, or even in pediatrics population. Thank you so much, Dr. Nadir. Thank you so much, everybody, for your insights.
Thank you so much, Mohammed. Okay, this is a great question also, or suggestion, post-COVID and the use or overuse of the sanitization. So I think it's a great idea. But again, the question is how you want to carry out this. Think about the population that you want to focus on. You said it could be geriatric or pediatric or in the mid. But also think about where you want to focus your question. Is it hospital-based or outpatient-based or clinics and so forth? So depending on where you want to study, I think comes the question of how we can approach the identity. And then what exactly the variables in your study you want to get. You are thinking of conditions. Try to put this in a list of is this increase, decrease, or the same, something like that. And the use of antibiotic for this condition, is it repeated courses needed, something like that. So I think it needs, as you said, refining more of the question and then thinking about what the target population and where you want to get your information from. But it's a good idea. Sumi, go ahead.
Yeah, I just want to say that, yeah, same, as last year, like we collected the data, but all of your like Sarah and Dr. Mohammad Tegani, like all of your ideas are great, but it will take time to collect those data and all that. Of course, Dr. Nadir explained very well, but if you guys really wanted to start that, I think it's a good idea to start the IRB, because anyway you have to go through this IRB and it will take a lot of time to like back and forth the different types of questions and all that. So if you guys are really interested, I think I would suggest that to start the IRB from MSU. I can send you, both of you, the link if needed, and then just submit it, the whole protocol and whatever the things, and then you can just do it, because I'm sure that it will take at least 2 to 3 months, because last year I think Dr. Nadir still expedited the IRB, still we had to wait a little bit of time to get this data and all that. It always takes time. So I mean, that's my only suggestion, that we have to do IRB anyways. For my vaccine hesitancy project, although I'm a MSU student, but as this funded by different source, so that's I had to go through IRB also, although like I'll be writing a manuscript without any data, but it will be considered as a quality improvement project, but still I had to go through IRB. So what I suggest, and no matter what, probably we all have to, with these things, we have to go through IRB, and they will decide that IRB will decide that we need how extend to the IRBs. So I think it's a good idea to start IRB at this time point. So, if we have 2 or 3 months, so we can move forward. Thank you.
Thank you so much, Sumi. This is really great. And you touch on a big topic, which is IRB. And I think it's a good thing that you raise this point. So we have a couple of minutes before 4 o'clock our time. And again, we can continue the meeting, but for those who have other obligations or other things they want to do, please feel free. And the next section, we're gonna go over planning for next meeting. I'm gonna share my screen with you guys. And then after that, we will continue. So for next meeting, it's gonna be on the 10th. For the agenda, I think the green team, if they can present some of the basics, it's a big topic about the ethics in research. If they can speak about or present 20 to 30 minutes in the basics. And then if some of you also can present the process of the IRB application and the steps of approval. If you can take some time to explain this, because I don't think that's clear for us in medical school. And even when we graduate, when we do some research work, unless you get involved with IRB process, you will not understand the whole concept or the procedure steps involved in that. So I think these are the two topics. And if someone can continue with the SPSS tutorial. So if one of the previous follows batch one can volunteer to discuss their project, maybe we can each week for the next couple of weeks, we can take one project and take it from the conception of the idea, the steps of designing, and then gathering the data, and then presenting the data and applying through the conferences, submission and acceptance and so forth presentation. That would be great. So I need volunteers to put some information. And again, for all fellows, this is the way we plan ahead. So in the main page, when you come here, you will find this coming up meeting. If you click on it, you will have the meetings and which team will be presenting, and hopefully the topics will be here. If you are in that team, you can click on the pen here, and then you can edit whatever, let's say Dr. Mazen will be presenting. So I'll just type it, Dr. Mazen will be whatever. And then you can just click done, and it will be saved for the rest to review. So any questions so far? So I'll just go over one more thing, and then I'll go to the questions. So if you go to the menu here, there is a file or files icon. In this file icon, if you click, you will have the recent files that uploaded, but you can go over the whole list. But for this discussion, I want you to look at these two ACP presentation. One of them was presented by the residents, and one of them by medical students. That was 2 years ago. So if you open one of the files, it's a PDF file, and it will open the file for you. It has a long list of posters or oral presentation that submitted and accepted and actually win the prize by these residents or by these students. So it will give you an idea about how residents or medical students think about stuff at that time. Most of it is in 2019. I couldn't get the abstract or for last year. So if you have success, you can look that up. But this one way to think about how you refine your question so that it can be answerable and can be doable, and at the same time can be submitted and can be accepted in conferences and so forth. We were talking about ways to do research or to publish or to contribute to the research environment. So one thing is you don't need to do data analysis or data collection. Is perspective. Some articles you can just write about your experience, or you write about your situation in certain time, let's say COVID, and this can be submitted to big journal like New England Journal, and they have some of these. So this is just an example of some about the geriatric medicine. So if you want to look at that also, it will give you a view of what you can do without going into collecting data and doing some of the things that we were talking about. So this part you can do it at home remotely. Another way of doing is if you are interested in certain area, let's say you are interested in diabetes, so follow the big journal like New England or JAMA and read more about the topic and see if there is a recent article came out about the topic that you are interested in. And if you can write a follow-up letter to the editor, that's also an easier way of doing some publication you can add to your list of things that you can do. So if you have time, go over these three files. If you have extra time, you can go over Sparrow. They have some posters. These were done also this year. So this, you can look at them as sample, also think about the questions they ask and how they come up with a plan of designing and then collecting the data. So if you look at this, these are more recent and more to the hot topic of maybe COVID and similar way like sanitation and how this can be affected in at the time being. So I'm gonna stop sharing. If you have any questions, please let me know. If you have any comments, go ahead. Thank you. Okay, Khalid Osman, please go ahead.
Yes, thank you, Dr. Nadir. I wanted to say that I could volunteer to talk about my project next week.
Excellent. Thank you so much, Khalid. So we can add you as a presenter for the Sumi, can you
Hello. Khalid, are you going to present next week? That's what you are trying to say?
Yes.
Okay. Regarding what, I can update the app.
Yeah, regarding the previous projects we did last year.
Okay.
Yeah,
Okay.
the poster
That's it.
abstract presentation. I wasn't part of the data collection. I believe you and Dr. Nader did that, but maybe I can just talk about writing the abstract itself.
Sure, sure. Yeah, because the data was not accessible to anyone, right? So
Yes.
as we are MSU affiliated, so we had to collect the data, but that's fine. Yeah, I can update that on the app, and I think Dr. Nadir is back now. Thank you. Yeah.
Sorry about that. Yes, thank you so much. Thank you, Khalid. So Khalid will be, it shouldn't be long. It's just a brief, just introduction about how we came up with the idea and the steps of doing the design and forms until we finished. Excellent. Any questions? Otherwise, any other comments? Otherwise, suggestions? So if not, it's 4:10. We will see you next week. Hope you have a good day, nice weekend, and enjoy your rest of the day. Thank you.
Thank you, everyone.
Thank you, everyone.
Thank you, Doctor.
Thank you.
Thank you.
Thank you, everyone.
Thank you, everyone.
Thank you. Thank you, everyone. Have a great day.
Thank you.
Thank you, Dr. Nadir. Thank you, everyone.
Thank you.
Thank you.